Understanding heart attacks is crucial. A heart attack is a serious medical emergency. It occurs when blood flow to the heart muscle is blocked. This blockage is usually caused by a buildup of plaque in the arteries that supply blood to the heart. Without enough blood, the heart muscle begins to die. This can lead to permanent damage to the heart. A heart attack is life-threatening, but early treatment can save lives. Recognizing the symptoms of a heart attack is crucial. The most common symptom is chest pain, often described as a crushing pressure or tightness. However, symptoms can vary, and some individuals may experience atypical presentations. It's important to remember that time is of the essence when it comes to heart attacks. Seeking immediate medical attention at the first sign of symptoms can significantly improve outcomes. Heart attacks are primarily caused by coronary artery disease, or CAD. CAD develops when plaque, a substance made up of fat, cholesterol, calcium, and other substances, builds up inside the coronary arteries. Over time, plaque hardens and narrows the arteries, restricting blood flow to the heart muscle. This process is known as atherosclerosis. Several factors contribute to the development of CAD, including smoking, high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, and a family history of heart disease. Understanding these risk factors is essential for prevention and early intervention. By adopting a heart-healthy lifestyle, we can significantly reduce our risk of developing CAD and subsequent heart attacks. Making healthy lifestyle changes is crucial for preventing heart attacks. One of the most important changes you can make is to quit smoking. Smoking damages your blood vessels and increases your risk of blood clots. Eating a healthy diet is also essential. This means choosing foods that are low in saturated and trans fats, cholesterol, and salt. Focus on fruits, vegetables, whole grains, and lean protein sources. Regular physical activity is another important lifestyle modification. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Managing stress is also important for heart health. Find healthy ways to cope with stress, such as exercise, yoga, or meditation. In addition to lifestyle modifications, medications can play a vital role in preventing heart attacks. For individuals with high blood pressure, medications such as ACE inhibitors, beta blockers, or calcium channel blockers may be prescribed. These medications work by relaxing blood vessels and reducing the workload on the heart. Statins are another class of medications commonly prescribed to lower cholesterol levels. Statins work by reducing the production of cholesterol in the liver. Aspirin is often recommended for individuals at risk of heart attack. Aspirin acts as a blood thinner, preventing blood clots from forming in the arteries. Recognizing the warning signs of a heart attack can be life-saving. Chest pain is the most common symptom, often described as a tightness, pressure, or squeezing sensation. However, not everyone experiences chest pain during a heart attack. Other common symptoms include shortness of breath, nausea, vomiting, sweating, lightheadedness, and pain or discomfort in the arms, back, neck, jaw, or stomach. It's important to remember that symptoms can vary from person to person, and some individuals may experience atypical presentations. If you experience any of these symptoms, especially if they are severe or persistent, seek immediate medical attention. Emergency response: acting swiftly to save lives. If you suspect someone is having a heart attack, it's crucial to call emergency services immediately. Every minute counts, and prompt medical attention can significantly improve outcomes. While waiting for the paramedics, help the person sit or lie down in a comfortable position. Loosen any tight clothing and try to keep them calm. If the person is unconscious and not breathing, perform CPR if you are trained. Automated external defibrillators, or AEDs, are available in many public places and can be used to restart the heart in case of cardiac arrest. Remember, time is muscle when it comes to heart attacks. Acting quickly and decisively can make a life-saving difference. Treatment options: restoring blood flow and function. The primary goal of heart attack treatment is to restore blood flow to the heart muscle as quickly as possible. This can be achieved through various methods, including medications, angioplasty, or surgery. Medications such as aspirin, nitroglycerin, and clot-busting drugs may be administered to dissolve blood clots and improve blood flow. Angioplasty is a minimally invasive procedure that involves inserting a catheter with a balloon on its tip into the blocked artery. The balloon is then inflated to widen the artery and improve blood flow. A stent, a small mesh tube, may be placed in the artery to keep it open. In some cases, coronary artery bypass surgery or CABG may be necessary. CABG involves taking a healthy blood vessel from another part of the body and using it to create a detour around the blocked artery. Life after a heart attack. Embracing a healthier future. After a heart attack, it's essential to make lifestyle changes to prevent future cardiac events. These changes may include quitting smoking, eating a heart-healthy diet, exercising regularly, managing stress, and taking medications as prescribed. Cardiac rehabilitation programs can provide valuable support and guidance during recovery. These programs typically involve supervised exercise, education on heart-healthy living, and counseling to help individuals cope with the emotional and physical challenges of recovery. It's important to remember that life after a heart attack can be fulfilling and meaningful. By adopting a proactive approach to heart health, individuals can reduce their risk of future events and enjoy a higher quality of life. Conclusion: empowering yourself for a heart-healthy life. Heart attacks are a serious health concern, but they are often preventable. By understanding the causes, recognizing the warning signs, and adopting a heart-healthy lifestyle, we can significantly reduce our risk. Remember, time is muscle when it comes to heart attacks. Seek immediate medical attention if you experience any symptoms. By taking proactive steps to protect our hearts, we empower ourselves to live longer, healthier, and more fulfilling lives.